Okay, so good morning, and this is part 3 of our module 2 enzymes. So for part 3, we'll be talking about liver enzymes. So these are the following liver enzymes that you will test or that will be requested kapag titingnan if may damage or kung okay ang iyong liver. So alanine aminotransferase, alkaline phosphatase, lactate dehydrogenase, gamma-glutamyl transferase, aspartate aminotransferase. Okay, so may nabanggit dito nakasama dun sa ating MI profile. Yan. So nabanggit yung AST. Okay, since yung AST kasi ay wide distribution or marami din siya sa ibang tissues natin, so hindi siya definitive. So, nabanggit din yung LD. Okay. So, alanine aminotransferase, formerly called serum glutamic pyruvic transaminase. So, parang yung isa, similar to AST, catalyzes transfer of amino group from alanine to alpha-ketoglutarate with the formation of glutamate and pyruvate. So, yun yung ating byproducts. So, distributed in many tissues, highest concentration is in the liver. Pinakamataas yung concentration niya sa liver tissues. So, it is more liver-specific enzyme among the transferases. So, sa mga transferase, siya yung mas specific sa liver, SGPT. Okay, so it is used to evaluate hepatic disorders. So, ALT elevations are higher than AST. So, kapag may problema sa liver, mas mataas yung results na itinataas ng ALT compared sa AST. So, cardiac tissue contains a small amount of ALT. So, may konti lang daw. Next, alkaline phosphatase. So this catalyzes hydrolysis of phosphoesters, cleaves phosphate group of the phosphomonoesters, producing phosphate ion. So not as specific, can react with many different substrates. So more active in alkaline pH. So titingnan na pangalan, alkaline phosphatase, alkaline pH. So this requires magnesium as an activator. So it is used in the evaluation of hepatobiliary and bone disorders. So alkaline phosphatase pwede sa liver, sa bile, and sa ating bones. So alkaline phosphatase ay may iba-ibang isoenzymes. So liver, ALP, it is increased in liver diseases. Bone, ALP, increased in bone, healing of bone fractures and physiologic bone growth. Placental, ALP, so increased in pregnancy. Intestinal, ALP, so increased in GIT disorders. So meron pa tayong ibang fractions ng ating alkaline phosphatase, so regan and nagaw. So yung regan is the most heat stable. It resists heat denaturation at 65 degrees Celsius for 30 minutes. Mataas siya if may malignancy. Then nagaw is a regan variant, cancer of pleural surfaces, adenocarcinoma of pancreas, adenocarcinoma of bile duct. So for now, tandaan nyo itong maigi. 65 degrees for 30 minutes. Magagamit natin yan for alkaline phosphatase testing. Next is GGT. So GGT catalyzes transfer of gamma-glutamyl residue from peptides to amino acids or water molecules. These are present in cells in bile and hepatic ducts. So GGT is increased in hepatobiliary disorders or biliary tract obstruction, chronic alcoholism, enzyme-inducing medications, so kapag naka-warfarin, phenobarbital, and phenytoin. Smoking. So, tandaan nito. Smoking increase for moderate, 10% increase for moderate smokers, and 20% increase for heavy smokers. So GGT is useful in differentiating the source of elevated ALP. So kapag mataas yung ALP, pwede mong i-check ang ating GGT. So kapag ang GGT ay mataas, so ang probable source ng ating ALP is the liver disorder. Pero kapag normal yung ating GGT, yung ALP natin ay pwedeng placental or skeletal ALP isoenzymes. So parang series of tests yan i-request ng doctors, pero usually madalang i-request ang GGT. So to confirm lang siya if kailangan pang i-assess ang situation or ang condition ng patient. Halimbawa nga, mataas yung ALP. Since ALP natin distributed din, pwede mo siyang bigyan ng follow-up na tests. So papahabulan mo ng GGT. So yun nga, kapag mataas ang GGT, possible source ng elevated ALP is the liver disorders. Kapag naman normal yung ating GGT levels, then the ALP is skeletal or placental ALP isoenzymes. So next group of our enzymes is the pancreatic enzymes. So dalawa siya, amylase and lipase. So the amylase is increased in acute pancreatitis, but it is not specific. Requires calcium and chloride for activation. It is the smallest enzyme. So tandaan, smallest enzyme, molecular weight of 50,000. So amylase is the only protein that can be cleared by the kidneys. Amylase levels during acute pancreatitis. So they rise at 2 to 12 hours, peak at 24 hours, and normalize within 3 to 5 days. So if suspect for acute pancreatitis or pancreatitis yung patient, so ito yung possible na ating sundan. So request it within 2 to 12 hours, rising period pa lang yun. If within 24 hours or 24 hours na, peak ng rise ng amylase yun. So kapag nag-test ka ng 24 hours of onset for the pancreatitis, dun mo ma-detect yung highest level ng amylase. So normalize within 3 to 5 days. So other elevations are seen in mumps and parotitis. So parotitis is salivary gland lesion, diabetic ketoacidosis, renal insufficiency. So mataas siya sa renal kapag may renal insufficiency, nataas ang amylase kasi hindi siya natatanggal sa system, di ba? Siya lang yung only protein that can be cleared by the kidneys. Intra-abdominal diseases like peptic ulcer and intestinal obstruction, along with cholecystitis, cystitis, and acute appendicitis. So may variant tayo ng amylase. So macroamylasemia. So this is a condition pala, sorry. So condition wherein this results when amylase, AMS is amylase molecules combined with immunoglobulins to form a complex that is too large to be filtered across the glomerulus. So nataas siya. Serum amylase levels increases because of the reduction of the renal clearance. So hindi nga siya na-filter, kaya tumataas yung levels ng amylase. Okay, so ito yung ating variants ng amylase. So meron tayong dalawa, P-type and S-type. So P, so tandaan, amylopsin. P-type, P. So derived from pancreatic tissues, P-type pancreatic amylopsin. The pancreatic isoenzyme migrates more slowly. Saan yung migration na yon? Sa ating electrophoresis. So P3 is the most dominant in acute pancreatitis. S-type or thiolin. So this is derived from salivary gland. S-type. Salivary isoenzyme migrates most quickly. S-type represents 2/3 of amylase activity and serum. So, ibig sabihin, 1/3 na lang yung ating P-type. Okay. Lipase. So, lipase hydrolyze esters linkages of fats to produce alcohol and fatty acids. So, this is the most specific marker for acute pancreatitis. Large molecules remain in the circulation for up to 7 days. So, during acute pancreatitis, they rise at 8 hours, peak at 24, and normalize 8 to 14 days. So, a summary of the rise, peak, and normalize of amylase and lipase. So, rise, peak, then normal. So, may mga, para siyang yung sa bacti din yung ating log. Kung naalala nyo yun. Rise, peak, then normalize. So, other enzymes, acid phosphatase. So, this is the last enzyme that we will be discussing in our module. So, acid phosphatase is a prostate enzyme. Catalyzes hydrolysis of phosphomonoesters, and it is used in the evaluation of carcinoma of prostate. So, pwede din siya magamit sa forensic investigation of rape cases. It can be detected or nandun pa siya nag-stay for 12 hours up to 4 days. So, pwede ka makakuha ng sample, then test it for acid phosphatase. If mataas ang acid phosphatase levels, then if present ang acid phosphatase, then possible rape case ang patient. So, non-specific. It is found in the liver, spleen, and kidneys, bone, red blood cells, platelets, and the prostate is the richest source during prostatic carcinoma. So the next module or part of the module will contain the methods of determination. So hanggang dito yung discussion natin sa enzymes. Then the next part, kung paano natin siya tinetest or mga tests na ginagawa natin sa mga enzymes na na-discuss. Thank you.